Good afternoon, and welcome to the DSDR, a Population Health Data Archive, 20 Years of Sharing Research, Data, and Resources webinar. My name is Sarah Rush, and I'll be one of your speakers today. And now I'd like to give you a warm welcome to Dr. John Marcotte, Director of DSDR. John, the floor is all yours, and the recording has already started.
Thank you, Sarah, and thank you to all the attendees for attending this. This is DSDR's 20th anniversary. We're in the middle of a birthday year, so I want to thank all of you for coming. We wish you could offer you some virtual cake for today, but if you look at our anniversary logo, it's a population pyramid topped with a little cake. So happy birthday to us, and thanks for joining us. Next. So the DSDR team, the core team, you've just met Sarah Rush, who's one of our data project managers. Sarah focuses on deposits and on our outreach. If you want to deposit data with us, Sarah is the person you're most likely to interact with. Kelly Ogden-Schuette is our other data project manager, who focuses on restricted data and researcher support. And I'm John Marcotte. I'm the project director at PI for DSDR. Next, please. We're funded by the Eunice Kennedy Shriver National Institute of Child Health and Human Development, which is an institute of the National Institutes of Health. We're hosted by ICPSR at the University of Michigan. DSDR is a platform for discovery, access, and sharing. Those are our bywords: discovery, access, and share. So what we're interested in is research data on population health studies. Now, what that means is data with external validity, data that can be generalized to a population. But DSDR is more than just a data source. It's also a locus for information for people who want to collect, analyze, and distribute data. We have many resources about disclosure risk, about how to work with your data management and sharing plan, and how to just deal with data in general. And of course, as I said earlier, we're celebrating our 20th anniversary, and we're excited, and happy birthday to us. As I was saying, discover, access, and share are our bywords. And discover is a word that we always need to be happy with because it's kind of enhanced findable. For those who are familiar with the FAIR principles, findable, accessible, interoperable, and reanalyzable, those bywords are really excellent. But discover goes beyond just findable. It enables people to actually search for data, find it in context. And that's where we really excel, because you're able to search for data both by study topic, by study name, but also internally by variables. So discovery is really important. Our focus is on maternal and child health, health disparities, cross-national comparisons, international health comparisons, families and household. Access. We provide public access data, which is downloadable from our website. We provide online analysis, and we also enable you to apply for access for restricted data. Note, for all of our data from public to access, there is no charge. We do not charge for any of our services. For sharing data, this is where we very much want you to deposit your data with us. You can meet the NIH data sharing requirements by depositing with us. But there are 2 points that people always have to be concerned with a repository. One is provenance, which is the history of the data, keeping all the documentation. And the second thing is historical preservation, both of which DSDR and our parent organization, ICPSR, have a long history. DSDR having a 20-year history, ICPSR having over a 60-year history. Next. I'm going to turn it over to my colleague, Kelly, to tell us about discovery data and resources.
Thank you, John. Sarah, next slide. So to expand a little bit on what John was just talking about, on the DSDR website, you can either search across studies or within studies. Next slide. On our Discover page, you can browse by studies, variables, geography, investigator, and so on. If you'd like to browse by subject, we have a range of formulated queries such as children and youth, migration and population distribution, childhood obesity, and others. Next slide. Using our search bar, for example, for fertility, we'll search the data holdings. You can switch to the variable or publication results. You can narrow the results using the filters on the left-hand side, and you can sort by relevance, last updated, and other options. Next slide. The variable search will identify name, question text, variable type, and data set, as well as the study. Clicking into a specific variable will provide more specifics about the variable, as well as a link to the related study. Next slide. Variable comparison is especially useful for searching across studies for similar variables and then delving deeper into those variable similarities and differences across topics. Next slide. Our publication search results in citations with links to export options, a link to the study or studies related to the work, and, if available, links to full text copies. Next slide. When you are on a particular study page, you can also see the related publications by selecting the appropriate tab circled here. Next slide. For accessing our data and resources, there are several ways to do this. Next slide. We have public data, which is available in multiple formats. To download this, you need a free ICPSR account and to agree to the terms of use. Next slide. As John mentioned, we also have online analysis. This is available for select studies. Our full analysis capabilities, for example, allow for recoding and computing of new variables and a wide range of analysis options, including regression. Next slide. Currently, our top downloaded studies include Add Health, the India Human Development Study Series, MATLAB, Babies' First Years, TransPop, and Generations. Next slide. We have some featured studies with LGBTQ data, including Generations, TransPop, and a newly available Combined Generations Wave 1 and TransPop survey. We also have the NCHAT data and the IPUM's Contextual Determinants of Health series for use with that NCHAT data. Next slide. Other new data includes our child trauma data collection from the Children's Hospital of Philadelphia and the Future of Families and Child Wellbeing study, public use. Updates include the TLT verbal autopsy data and the addition of the AAPI variable to NCHAT. Next slide, please. Additional health data includes the IHDS series, previously mentioned, the Los Angeles Family and Neighborhood Survey series, Add Health, the National Survey of Adolescents series, and SECCYD. Next slide, please. Documentation is a priority for DSDR. Data documentation includes study descriptions, instruments and measures when provided, codebooks and frequencies, and suggested data citations. For Add Health, the Chitwan Valley Family Study Series, and the IHDS series, we have data guides available, and we will be developing additional guides going forward. The data guides are help with common analysis issues, such as weighting. The data-related bibliography has over 45,000 publications related to studies managed by DSDR. It is searchable by study, author, title, or year, and it covers journals, reports, books, book chapters, dissertations, and so on. Full text options are available for many of the citations. Next slide, please. DSDR also has restricted data. For restricted data, this requires a legal application and an IRB or ethics committee review. We have three options for accessing the restricted data. One, secure download, where the data is sent via encrypted download to approved machines and locations. Two, the ICPSR Virtual Data Enclave, VDE, where the data remains on our servers and is accessed remotely from approved machines and locations. And three, for very specific studies, the Physical Data Enclave, which requires researchers to come in person to ICPSR to use the data in a cold room. Importantly, for all access methods, researchers must follow protocols for protecting human subjects. Sarah will now discuss depositing data with DSDR. Thank you.
Thank you, Kelly. I am going to cover how you can share your data and data-related resources. And first, I want to walk through some of the benefits of depositing your data with DSDR, which include the ability to advance science by making your data available to other researchers for secondary analysis, to meet funding requirements for data sharing, knowing that deposited files are permanently archived and supported through changing technologies, new media, and data formats. Data disseminated through DSDR are available at no charge and are cross-listed through the ICPSR membership archive and other topical archives within ICPSR. This increases exposure to a wide range of audiences. Another benefit is that all studies released through DSDR received a direct object identifier, or DOI, to aid in data discoverability. Deposited data undergo data curation to enhance and add value to the data. This process includes a disclosure risk review to ensure confidentiality of study participants is protected. We also build and maintain a bibliography of data-related literature for studies in the DSDR collection and announce data releases when they occur on the DSDR website, our social media accounts, and also the quarterly newsletter that we release. Finally, we provide ongoing support to researchers and depositors, including consultations during the proposal phase regarding the development of data management and sharing plans. DSDR offers 4 deposit options. The first and most common is the standard deposit, in which the data and documentation are deposited exclusively with DSDR, and DSDR becomes the sole source for distribution of the data. It's important to note that restricted data must be an exclusive deposit in which DSDR is the only point of access in order to maintain proper protection and management of the restricted data. In the case of a mirror deposit, the same data and documentation files are made available through multiple archives, with one archive being designated as the authoritative source. This deposit option is available for public use or access data only. And one use of the mirror deposit option is to share data and specialty archives across different continents. DSDR also allows for the deposit of study and variable level metadata. Study metadata is made available through DSDR, the catalog that is, in the form of a union catalog record. This allows for discovery of data available from an external source and searches conducted at the study level. Variable metadata deposits allow for greater discoverability by allowing for both study level and variable level searching. The variable labels and question text are searched based on the search term, and the search results allow you to compare variables within that variable metadata study to variables for which DSDR makes the data available as part of its holdings. This can be a good option for an ongoing study that has frequent updates to the data files. And it's important to note that a link to the external data source is provided for both study and variable metadata records. DSDR accepts deposits related to maternal and child health, health disparities, and the human life cycle in 3 priority areas identified by NICHD. The first priority is data resulting from support by the NICHD Population Dynamics Branch. The second priority is data that provide opportunities for researchers working within the scientific scope of the NICHD Population Dynamics branch that were supported by sources other than the NICHD Population Dynamics branch. And the third priority is data that result from support by the NICHD Division of Extramural Research from sources other than the Population Dynamics branch, with an emphasis on behavioral and social science research data. Related to deposits, DSDR can help with your data management and sharing plans by providing letters of support, endorsing research and data archiving plans. The ICPSR Share NIH data page includes a template data management and sharing plan with language that can be copied, pasted, and modified in your own plan. ICPSR can also provide cost estimates for curation through DSDR. We ask that you allow 10 business days for an estimate, and requesting an estimate sooner is always better. There are also ICPSR hosted webinar recordings and instructional videos related to data management and sharing plans. Finally, you can always email us at any time with your questions. What to include in your deposit? So, for data files, we accept quantitative data files and prefer them to be in SPSS, data, or SAS format. We prefer that you have defined variable labels, value labels, and missing data codes. Again, this increases the usability of your data, and with the variable and value labels, that increases the discoverability as well in variable searches. We also accept qualitative data, video data, images, and geospatial data. For documentation, Kelly described some of the documentation that we have available. This includes codebooks or data dictionaries, data collection instruments, guides, project summaries, and data-related citations. We have also started to require respondent consent forms, not the individual signed ones, but the template, as well as your IRB approval to be deposited with the data. If you have other documentation that you think would be useful for data users, we definitely encourage you to deposit that as well. Also, the study description or the study level metadata. There are only 3 components that are required. This is the study title, principal investigator name, and the summary. However, we encourage you to submit information about the study design, sample, methodology, or any of the fields that you see in the deposit space in order to increase both the discoverability and the usability of your study. So this is where we get to how do I do it? You want to start on the DSDR deposit page where there is a start deposit button. After you log in to ICPSR or create a free account, you'll then be directed to a pop-up box where you can enter the title of your deposit project before you're then taken to the screen that's shown here. Using the button to enter the title of your deposit, you can create folders and upload files. You can also copy and delete your deposit project using the More drop-down button. And that is all of that is shown circled in red. The section in the middle that's circled is the area where you'd enter your study level metadata. Again, only 3 fields are required, but we definitely encourage you to submit as complete of metadata as possible. To submit your data project, you're going to use that blue button that's circled on the right. And you can also share your deposit project with other collaborators. And finally, that last circle you see at the bottom around the project communication log allows you to submit extra information or questions to DSDR and keep all deposit-related communications in one space. You may need to click on, there's a little toggle towards the right that allows you to watch the deposit communications. Since DSDR launched in 2004, we have built a collection of over 800 studies with data accessible through DSDR. In addition, the DSDR catalog includes study or variable level metadata for over 170 entries that point to data outside of ICPSR to help researchers discover data resources regardless of their location. The DSDR collection also includes over 1.4 million searchable variables and over 45,000 data-related publications. So that's looking backwards, but looking to the future, things we are focused on in the more immediate future include releasing additional data sets for the Child Trauma Data Series, Chittenden Valley Family Series, the new Immigrant Survey Series, as well as the Age 4 data for baby first years. We'll also be developing more resources to help researchers with human subject protection and disclosure risk mitigation, as well as resources to help researchers meet NIH data management and sharing policy requirements. We are also going to work to expand our non-survey data, including more videos, neuroimages, genomics, and qualitative data sources, and create additional data guides. We invite you to connect with us. The QR code on the left-hand side leads to our link tree, which includes links to DSDR social media accounts, various pages on the DSDR website that were covered today, as well as the link to sign up for our quarterly newsletter. We encourage you again to reach out with any questions you have via the email shown here or by phone. And with that, we're going to open up the webinar for any questions you have for the DSDR team at this time.
Sarah, we had a couple questions submitted ahead of time, and I don't see any in the Q&A just at the moment, so we'll go ahead and start with those while we're waiting for the others. The first was, can you tell me what you mean by population health?
John, do you want to take that one?
I will take that one. Thank you for the question. Population health, again, it's data from a data standpoint. It's data, again, with external validity, generalizability to a population. But in terms of analysis, it's about the overall health of groups and populations. We're not so focused on individuals as we are in terms of focused on groups. So when we're talking about health, we're generally looking at health rates for populations or subpopulations, not necessarily for individual. Our data, however, can be used to assess whether or not certain characteristics increase risk of health events or adverse health events as well. But generally, what population health we mean by that is data related to groups. How can we extrapolate or talk about the health situation of a particular group, subpopulation, or population? And as you can see in our data, one of our mandates from NICHD is to try and get data for populations that don't have very much data in. And so, for instance, you've noticed that we have a growing collection of data for the LGBTQ community, because there was very little data about health for that population, but a lot of interest. So we are trying to do that. We have data on migrants, another group that people are very interested in. So that's our mission. Thank you, Kelly.
Thank you. And the next question that showed up in the Q&A section is actually, I believe, for me. It says, applications for restricted data tend to require a signature from an institutional representative. What sorts of positions at universities would count as such a representative and could sign an agreement on behalf of a university? So the advice that we usually give people is that an institutional representative, or IR, is somebody that can commit the entire institution legally to the agreement. And so that usually is somebody from an office of sponsored research, a contracts officer, a provost, a vice president, those sorts of people. Who does not usually qualify are deans, department chairs, other faculty. There can be exceptions to that, but we will ask for confirmation if you submit with those people signing. So usually the people who sign are either a contracts officer or someone from an office of sponsored research or something along those lines. Thank you. And the next question.
Kelly, let me just jump in quickly here. This is an important issue, and universities are being very careful as to who has signature authority for their organization. You have to check with your respective university or organization. But signature authority means something very specific. It's not just being able to sign. It's someone who, as Kelly was saying, can commit the organization. And typically is not a dean, a department chair. It's usually someone who's in your office of research or your contracting office. Thank you, Kelly. Sorry.
No worries at all. Thanks for the additional clarification. We have been asked in the past and also again here, what is the difference between DSDR and ICPSR? So John or Sarah, would either of you like to jump in on that one?
John, I'll let you take the lead on that, and then I can fill in.
Thank you, Sarah. And I just was looking for my mute button to say that. A great question. Okay, so ICPSR is our parent organization, and we have very similar missions. The difference is mostly in terms of funding and access. ICPSR is a consortium, and so the data that are curated by the consortium are available to members at no charge. DSDR is funded by the federal government, so all our data are available at no charge, regardless of consortium membership in terms of circumstance. DSDR leverages a lot of ICPSR services to be able to operate. And we also contribute to ICPSR services as well. One of the key differences between DSDR and ICPSR is in our approach to how we interact with our depositors and our researchers. Both of us do an outstanding job, but in our case, for instance, the DSDR does not change data without conferring with the depositor. We very much have a relationship with the depositor. The terms of deposit for ICPSR allows ICPSR to modify data to make any problems with disclosure or to fix any errors in the data. We also do that for DSDR, but we inform the depositor before we do it. We give them options. And it's more of having more of a personal dialogue with our research community. Obviously, our focus on data is more narrow than ICPSR. Our focus is primarily on maternal child health and on health disparities. ICPSR is much larger. It has everything from political data to data about substance abuse. So a much larger archive. So thank you for the question.
Sarah, was there anything you wanted to add to that?
Yeah, I think I feel like John covered everything. I think he already touched on that we use the core services of ICPSR, and so in many ways we are similar, but there are a few key differences that John highlighted.
And I think it speaks to one of the comments he made earlier and a frequently asked question, which is whether or not there's a cost for DSDR data. And the answer for that is the cost is covered by our funders, and so there is not a cost for any of the DSDR data in terms of the data itself or access methods. Whereas for some of the other archives or for the consortium data, there can be. So we encourage you to use DSDR data. It's free. Are there any other questions? I'm not seeing any other in the chat, but or in the Q&A. But would anyone like to add anything else before we wrap up for today?
Thanks, Kelly, for leading the Q&A. Of course, if anyone thinks of something after you walk away from here, or hopefully spend a little bit of time on the DSDR site, just reach out to us, and we're happy to talk with you. So with that, I'd like to thank all of you for joining this presentation about DSDR today. And once again, the slides and a link to the recording will be shared with you after the presentation. Thank you.